We have to help them, and we need them to hold us accountable as leaders. I'm Mike Heenan, and I'm the President and CEO of the St. Joseph's Health System. People have made a job or career decision to spend 12 hours of every day with us. And so when I read events that they've offered themselves up to their community to be in a healing environment to help, and then they're subject to violence, whether it's physical violence, psychological violence, racism, or sexual behaviors, it disturbs me. And it disturbs me because I'm, one, their leader who promised them a safe environment, because I believe in the Sisters' mission of unstoppable compassion, and because I think in this community we're all here to support each other. The vast majority of these incidents that we see are directed to the most vulnerable, marginalized parts of our staff. And so our commitment to equity, diversity, inclusion, and Indigenous reconciliation, combined with safety, is the moment where I said this is enough. Enough is enough. One, we're not going to solve this problem overnight, and we have to start somewhere. And this is the beginning of a dialogue. In my 2.5 years here at St. Joe's, I spend time both inside the organization and out in the community. The Greater Hamilton community, as an example, is a community of pride, a community of grit, and a community that truly cares about each other. And so let's start the dialogue about caring for our healthcare workers. 5 or 6 years ago in the COVID pandemic, we called them heroes. And now they're at a state of vulnerability. We need to recruit more doctors, more nurses, more allied health professionals into our sector. That sector needs to be safe. If staff, whether they're here at St. Joe's, another health provider anywhere in the country, says that this is just a part of the job, my answer to them is it doesn't have to be. I'm not in that job, so I don't have that lived experience, but as their leader, I'm saying we can do better. It behooves us to do better. You can walk into a coffee shop, you can walk into a bank, you can walk into a passport center, and there'll be a sign that says bad behavior is not going to be tolerated. The advantages those businesses have is they can ask you to leave. Because we work in an acute emergency room, hospital, we can't ask a patient to leave based on their behavior. But we can put systems in place, and we can support our staff to say, this is how we're going to approach this, so the safety environment is enhanced and the probability of you being subject to violence has been lowered substantially. And that's our goal here. But it should not be accepted as just a part of the job.